11 to 14 week scan, otherwise called the NT scan or the 45 to 84 millimeter scan. We will see the guidelines and protocols for this scan. Now, before advent of this 11 to 14 week scan, since 1929, the pyramid of traditional antenatal care was weeks, and a 12-week scan, that is the 11 to 14 week scan, the complications scan of various the complications of pregnancy can be predicted at this stage. So the risk of complications can be assessed. Depending upon that, you categorize women into pregnant women into high risk group who will, if anomaly detected, and incidence of chromosomal anomaly naturally comes down after 13 weeks and 6 days, and measurement of the crown rump length becomes difficult after this period because the fetus moves from horizontal to vertical position. So that is why the CRL, the scan is done between 45 to 84 millimeter of crown rump length. Now, what is the route of scan for this period? It is essentially, so first is look at the fetal heart pulsations. So fetal heart pulsations present, or if it is failed, it will be absent, and the rate has to be measured, and the rate has a bearing, we will see shortly. The crown rump length has to be used for assigning gestational age in all except in pregnancies by ART. Then once you have assigned the gestation age by crown rump length, then it is not changed in future. It is not reassigned in future. Now, what are the criteria for taking the crown rump length? That's how it affects the risk calculation in aneuploidy, we will see. So here you see the nuchal translucency 2.4, the free beta and early genetic diagnosis, and easier termination because of the period of gestation. But the limitations of fetal anomaly diagnosis, we have to look for the sign or lambda sign or the T sign to determine the chorionicity. Now, if you see the lambda sign as seen here, it is a thick layer of 2 layers of chorionic membranes with 2 thin amniotic membranes on either side. So the placenta extends in between and into the membrane. So that is looks like a lambda or the twin peak sign. So if this is seen, then it is dichorionic diamniotic twins with a single placental mass. But if you don't see the lambda or tricuspid flow to increase the sensitivity and specificity. Then we come to the placenta. Now in the placenta you have to look for the echo texture, look for masses and whether there are single features, or it may be a solid and cystic tumor of the ovary. It can be with flow on color Doppler. It can be a luteoma of the 45-84 millimeter scan is also the period where screening for preeclampsia can be done using the various parameters put forth with fetal medicine. Is not measured during the 45 to 84 millimeter scan. Again, the cervical length will be covered in a separate lecture. So this is the guidelines and protocols for the 45 to 84 millimeter scan, otherwise the 11 to 13 weeks 6 days scan. Thank you.